Hello guys, welcome to today's discussion. So in today's presentation, we are simply going to look at how to write a post-operative nursing care or management. So if you are a student, please do make sure that you subscribe to this channel, you like and you share this video. So before we go any further, we first have to understand, what does post-operative nursing care mean? So if you look at the word post-operative, it simply means after an operation. So, this is the type of nursing care or management that you offer to the patient after an operation. So, this is the nursing care that you give to the patient after an operation. So, what are the first thing that we are supposed to write are the aims. Now, why do we write the aims? The reason why we write our aims is to show the examiner that at the end of our nursing care, these are the objectives that we are simply trying to achieve. Now, most students, when you are writing the aims, they do not reflect the nursing management that you are writing. So please do make sure that when you are writing your nursing care or nursing management, the aims on top should reflect the nursing care. So you only write two aims in an exam. So these are the aims. So the first aim that we have is to relieve the patient from pain and promote recovery. So that is the aim number one. So when you look at this aim, all patients that go through operation, they complain of pain. Okay, when a patient has gone through an operation, they'll complain of pain. And it is a duty of you as a nurse to give prescribed medication when the patient complains of pain. You are supposed to give prescribed what? Analgesic to relieve this patient from pain, as well as promote recovery. Then the second aim is to prevent post-operative complications such as wound infection. Now, most patients that go through operation, they end up having wound infection. Now, it is a duty of you as a nurse to ensure that you prevent wound infection. So there are multiple ways that you can prevent a wound infection. So when you look at these two aims that we have written, guys, these they can apply in all conditions or in all situations. So once you write the aims, what next? Now remember, we have not yet transferred, the patient has not yet been transferred from theater to the ward. So the next heading will be collection of patient from theater. So we have the next heading, which is collection of patient from theater. So how do you collect the patient from theater? So you are supposed again to write, show the examiner that what will happen during this period is ABCD. So these are the notes that you can see here. If you want, you can, understand them, read them, but I'm just going to quickly read through and explain the reason why we have written like this. So we simply say, upon receiving a call from the recovery nurse that the patient is ready to be collected, I will carry with me a post-operative tray containing a mouth gag to open the patient's mouth, a padded spatula to prevent tongue biting, a tongue depressor to prevent the tongue from rolling back, gloves to wear when cleaning secretion from patient, sterile swabs to clean the secretion, oral airway to intubate the patient in case of airway obstruction. Now, when you are writing this, you need to make sure that whatever tool that you are going to carry, you give a rationale. Why are you going with a mouth gag? You want to make sure that you prevent you want to open the patient's mouth. Why are you going with this? You give a rationale to why you are writing or why you are picking that tool that you are going with to the recovery room. Again, the other thing is that We don't just go to theater. When the patient has been operated, the patient goes to the recovery room. Okay? Then once the patient has been stabilized there, the recovery nurse will actually call the unit or the ward where the patient is supposed to go. So you as a ward nurse, you receive a call from the recovery nurse. Then you carry those, you carry a tray with the things that you're supposed to carry with to the recovery unit. And you explain, you give a rationale, please, to the reason why you are picking that tool that you are picking. And in most cases, you as a ward nurse, you are not the one to intubate the patient in case of air obstruction if you do not have the competency. All right, you just carry that tool. In case there is anything there, patient can have airway intubation. Then we write, after reaching the recovery room, I will get handover from the recovery nurse, which include patient's name, age, sex, type of operation which was done, latest diagnosis, findings which were found during an operation, and post-operative management to give to the patient on the ward. Now, remember again, guys, you are supposed to write in your essay how you are going to obtain the handover and what type of handover are you obtaining from the recovery nurse. It has to show in your notes. You can't just simply say, I'll collect handover from the recovery nurse. What type of handover are you collecting from the recovery nurse? So you collect the patient's name, age, sex, type of operation that was performed, okay? Latest diagnosis. Now, the patient might go in theater with hernia. The surgeons during an operation, they're going to correct that hernia. So the diagnosis of the patient will change. Another example that I'll give you, the patient can go in theater with intestinal obstruction. Now, during an operation, the surgeons are going to correct that and the diagnosis of the patient will change. So you are a ward nurse. You work, you are a ward nurse. You are not there during an operation. So the reason why you're obtaining all this information is that when the patient regains conscious, the patient will ask you the questions. And if you do not have the data, what are you going to tell the patient? So that's the reason why you are collecting all this information. So let's go on. Then after that, you need to make sure that you verify the patient's details. Okay, you have to verify the patient's details with the recovery nurse by checking the patient's what? Particulars on the identification band. Okay, on forehead or wrist. Now, usually in some hospitals, they put the identification band on the forehead. And in some situation or hospital, they put the identification band on the wrist. Now, the reason why you have an identification band is because this patient is unconscious. So they'll put the identification band for you to make sure that you identify that you are getting the handover of the right patient. Because you don't want to transfer the patient, you don't want to transfer the wrong patient to your unit. So you make sure that you verify the details, not alone. You cannot verify the details of the patient alone. You verify the details with the recovery nurse to ensure that you are getting or you are transferring the right patient. Then in some situation, the patient is unconscious. So if the patient is unconscious, what are you supposed to do? I will call his or her name to see if he or she will respond. Now, the reason why we have put these guys is that in different situation, the patient might be unconscious. Maybe the patient is sleeping. Okay, maybe the patient is sleeping. If you call the patient's name, they will simply just open their eyes. They cannot respond. They might open the eyes, which is a response. And if no response, I will gently pinch, okay, the patient's ear to see to see if he or she will respond to avoid getting or transferring the dead patient. Now, I know in some situation this might seem like it's not like a pinch, like inflicting pain or anything. You just want to see that the patient is able to respond to a stimuli, because in different situations the patient might be gone, the patient might be dead. Okay, and if you don't see the patient responding to a stimuli, you just simply transfer the patient. What if the patient is already dead and you transfer this patient? What will happen? So you need to make sure that you verify that the patient is alive. You also pinch. Then we go to the next section, which is the next heading, which is escorting patient on the ward or to the ward. So you are escorting now the patient on the ward. So you have finished obtaining the handover and you have identified or established that the patient is fine. So you now escort the patient on the ward. During an exam, you have to make sure that you show the examiner how you are going to transfer this patient. Now, you can use my case note. Now, you can simply say, I will wheel the patient to the ward on the trolley with the help of the porter, and the porter will be walking beside the patient's trolley, pulling the trolley and controlling traffic. Now, this is very much important. You are supposed to show the examiner how are you going to transfer the patient on the stretcher. In different countries they do it differently. So if you're working, like for instance, like whether in Africa, in Kenya, Zambia, or Nigeria, I don't know, whichever part, you are supposed to show the examiner, because it will only be you as a nurse and the porter. So you need to show how you're going to be transferring the patient, because you just don't do it anyhow. You need to write how you're going to be doing it. And the reason is that you as a nurse, you'll be responsible for ensuring that you keep on observing the patient as you are transferring the patient, because sometimes the patient's condition might change during a transfer. So we have the porter who is in front, who is pulling the trolley, and you're also giving the trolley guidance, because remember, when you're pulling the trolley, it can swing from side to side. So you as a nurse, you simply say, that's where the next bullet comes in. I'll be walking besides the head side of patient's trolley, pushing the trolley and observing the patient's condition. So this brings back to my earlier explanation. So this is how you write, guys. And now you're simply saying, we are saying controlling traffic. So the porter, when you simply say controlling traffic, when you are working in a hospital, there's so much congestion. People are going to see their relatives, there's this happening. So the porter will be simply saying, excuse me, while you are transferring the patient on the ward. So let's go to our next heading. So our next heading, this is where you write immediately post-operative management. Now, what is immediate post-operative management? Now, this is the management that you give immediately to the patient when the patient just arrives on the ward. So we write environment. Now, why are we writing environment? We need to show the examiner the type of environment where we're going to nurse this patient. So the first bullet, you simply say, I will nurse the patient in a surgical ward. So it depends. Is your patient in an exam, male or female? You write, you pick which one. Acute bay for easy monitoring and observation of patient's condition. You cannot nurse the patient in a subacute. This is the patient that has just come from theater. Anything can happen. So you need to make sure that you are nursing the patient in an acute bay. Now, the reason why you're in acute bay is for easy monitoring and observation. Remember, it gives you that room to see the patient in front of you. The second bullet is that I will nurse the patient in an environment whose floor has already been mopped by the cleaners with Jig 1 to 6, Windowsills, lockers, and bed rails dam dusted by me with Jake 126 to prevent infection. So you are actually showing the examiner the type of environment where you are nursing your patient. So if you look at the English, we are simply saying that you are nursing this patient in an environment where you earlier, okay, you are not doing it now, where you earlier mopped the floor. You just didn't mop the floor with plain water. You used Jig 126. Now, the reason why you're using Jig 126, it's a formula, okay, that you use for concentration. So you use jig to make sure that where the floor has already been mopped by the cleaners. So the cleaners used jig 1 in 6 to mop the floor. Now the reason why you're mopping the floor with the jig 1 in 6 to minimize infection. Again, you are nursing the patient in an environment where you earlier damp dusted the windowsills, lockers, bed rails with Jig 1 in 6. The reason why you are nursing this patient in this type of environment is to prevent infection. You cannot damp dust when the patient is there. You damp dusted earlier before. Then we go to the next bullet. I will nurse the patient in an environment where I earlier mobilized the working following. Get the English in it. I will nurse the patient in an environment where I mobilized the working following. You are not mobilizing them now. You mobilize them before the patient came, before the patient is on the ward. So what are some of the things that you mobilized? So number one, a drip stand to hang fluids. Give a rationale. What those things that you mobilize, they are for what? You're not just mobilizing anything. You give a rationale. What is this doing for? So a drip stand to hang fluids. A working suction machine to suction the secretion from patient's mouth and nose in case of any. Now, sometimes the patient can have secretions. It does not happen all the time, but sometimes the patient might have secretions. So you need to make sure that the environment where you're nursing this patient who's from theater, you have already a working suction machine, which is, it's very easy. And like when there's an emergency, you now start looking for a working suction machine. No. So a working suction machine to suction the secretion from patient's mouth and nose in case of any. A working oxygen cylinder for oxygen therapy. In case the condition of the patient deteriorates, you already have a working oxygen cylinder. Vital signs tray for checking and recording temperature, pulse, respiration, and blood pressure. You need to make sure that you have the vital signs tray next to the patient because you are not going to have time if the patient deteriorates. Another thing is resuscitative drugs. Okay? You need to have resuscitative medication such as adrenaline for any emergency. Okay, you can remove hydrocortisone such as what adrenaline in case of emergency. Then so these are the things that you mobilized earlier. Then we go. I will nurse the patient in an environment which has good ventilation to allow circulation of free fresh air. You cannot nurse a patient who's just from theater in an environment which does not have good ventilation. So make sure that you're nursing the patient in an environment which has got good ventilation. I will nurse the patient in an environment which has good light for easy observation and monitoring. This is the patient you are nursing who's from theater. Make sure that there is good light in this environment so that you observe. In case the patient is bleeding, imagine you are nursing this patient and the light is so poor. What will happen? It will be very difficult for you to know that this patient is bleeding. So you need to ensure that there's good light in an environment where you're nursing your patient. So we go to the next heading, which is position. After environment, we go to position. Now, these headings, they're supposed to go just like this, in sequence, just like this. Because your environment, then we come to position. So during position, what are you supposed to write? So when you're writing under position, you are supposed to demonstrate how are you going to reposition this patient. The patient is from theater. How are you going to reposition them? So number one, I will position the patient in supine with a head. You cannot again say, I will position the patient in supine position. That is a repetition. Okay. You have already said position. So I will nurse the patient in supine with head tilted and neck extended to allow drainage of secretion. If you see what we have simply, the meaning of this phrase is that I will position the patient in supine with head tilted and neck extended to allow drainage of secretion, is because you are not going to be with the patient all the time, checking that this and this is happening. So you need to make sure that you nurse the patient in this position to allow drainage of what? Secretion. Second bullet, I will change patient's position 2 hourly to prevent pressure sore formation and promote blood circulation. Different patients have got different different response to recovery. Some patients with major surgeries, they take long for them to regain conscious. Some patients with mild operation, they can regain conscious very fast. So you need to make sure that you reposition the patient every 2 hours. Now, the reason why you're doing it 2 hours, you are not making the patient uncomfortable. You are preventing a secondary problem, which is a pressure source. Now, remember, if the patient has got pressure sores, they can be very difficult to manage. So you need to make sure that you are repositioning the patient every 2 hours to prevent all these complications from arising. And prevention of pressure sores, you are promoting blood circulation. Once there's blood circulation to the tissues cannot undergo necrosis, which is the death of a tissue, of course. Another thing that you write is that I will apply prescribed moisturizer to prevent the skin from drying, which could result in skin damage. Make sure that you apply prescribed moisturizers to prevent the dry skin. Remember, when the skin is dry, it is very easy for it to get damaged. So we go to the next bullet. Observation. So under observation, what are things that you are going to observe as a nurse? Guys, this is how you write during an exam. So under observation, what are some of the things that you observe? Number one, I will quickly observe the general condition of patient to see if condition is deteriorating or improving. You as a nurse, you are observing, is this condition of the patient going worse or it's improving? Okay, you know what happens. If it is deteriorating, you inform the surgeons. If it's improving, then that's good. So I will check and record patient's vital signs to detect deviation from normal. You are checking the vital signs of the patient to see if they're normal or they're not. So you write temperature. In this case, patient will have hypothermia. You know why we have simply said in this case, we don't want, the examiner knows that this patient has undergone a surgical procedure. And what happens when you lose blood? When you lose a lot of blood, you become hypothermic. Okay? you become hypothermic when you lose blood. That's the reason why I'm simply saying at temperature, we say in this case, patient will have hypothermia because of patient being exposed to cold during an operation as well as loss of blood. Okay? Therefore, what are you going to do when the patient has got hypothermia? You need again to show the examiner all the steps that you are going to do when the patient has got any abnormalities. So this patient has got abnormalities of hypothermia. So what are you going to do? I will warm my hands before touching the patient to prevent, cold. Sometimes when you touch someone, your hands are very cold. They won't like it. Of course, we have simply said the rationale is to prevent heat loss by conduction. Um, I will cover the patient with extra linen to prevent heat loss by convection. I will switch on electrical heaters to prevent heat loss by convection. So always write a rationale in an exam. Even when you are working on the word, write a rationale. Why are you doing that? Because they always ask you, why are you doing that? You need to have a rationale, a reason. So let's go. We are still under observation. So pulse. So we are done with temperature. We go to pulse. In this case, patient who have tachycardia as the heart will be trying to compensate for reduced blood perfusion. Now remember, a patient has gone through a surgical procedure. So this patient has lost blood. So if someone has lost blood, what will happen is that the heart will be trying to compensate for the lost blood. So in response to that, this patient is going to have a tachycardia. What is tachycardia? Is rapid pulse, fast pulse in simple terms. So what are you going to do if the patient has got tachycardia? I will administer intravenous fluid alternating 3 liters to be infused within 24 hours to prevent shock and hypoglycemia. This is absolutely important. Now, I will administer. You cannot simply say they will administer. It is you. You are a nurse in this case. So you reuse the word I will. And this is during an exam. You use the word I will administer. It's you who's going to administer this prescribed intravenous fluid. 3 liters to be infused within 24 hours to prevent shock and hypoglycemia. When we say alternating, it simply maybe means maybe 1 liter dextrose, 1 liter normal saline, 1 liter this, depending with the surgeon's prescription. So we go to respiration. In this case, patient who have slow pulse, that is tachypnea. Therefore, I will commence oxygen therapy, 5 liters per minute to increase oxygen tissue perfusion. Now, this tachypnea, it does not happen all the time. Please get me right. It does not happen all the time. Sometimes patient after an operation, they'll just be fine. But in major operations, patients usually have tachypnea. That's the reason why most of them, they'll be on oxygen therapy. Okay? Yeah, so we go to another point. I will check patient's oxygen saturation using what are you going to use when you are checking the saturations of oxygen saturation? So I will check patient's oxygen saturation using a pulse oximeter, and if saturations are below 90%, I will commence oxygen therapy to increase oxygen saturations. The reason why you are checking oxygen, saturations, you want to see, if there is good perfusion of oxygen to the extremities of the patient. You don't want the patient to have any complication. So you actually commence oxygen to ensure that the oxygen saturations is fine. We go to blood pressure. So here we are on blood pressure. So blood pressure. In this case, patient will have low blood pressure because of bleeding during incision. So after the patient has gone through an operation, they are going to have low blood pressure because of bleeding. Sometimes they are fine. Therefore, I will administer intravenous fluid such as normal saline, which are plasma expanders. Why are you giving normal saline? Normal saline is a plasma expander. Okay, 3 liters to be infused within 24 hours to increase blood volume and allow tissue perfusion. Let's go on. What else are you observing? I will check the incision site, sorry. I will check the incision site to see if it's bleeding or not. And if bleeding, I will inform the doctor and apply compression pressure on the bleeding site using padded sterile gauze to arrest the bleeding. Now, in different cases, the patient might be bleeding from the incision site. What are you supposed to do? You need to inform the surgeon, oh, this patient is bleeding. Then you apply compression pressure on the what? On the incision site. But if the bleeding is massive, you cannot start by informing the doctor because the bleeding will be so massive. Okay? If the bleeding is massive, you apply compression pressure. Then, depending with where you work from, you press the emergency buzzer. The doctors will come, or the surgeons will come, and the other team members will come and help you. So you can write like this, it's fine. Then you also say, what else are you observing? I will observe patient's facial expression to detect pain and administer analgesic depending on the severity of pain to relieve patient from pain. Now remember, our first aim was to relieve the patient from pain. So have you seen how our aim is responding, how our nursing management is responding to our aim? So during this time, the patient might not talk to you that, oh, I'm in pain. You might see the facial expression of the patient. Then you know to say, wow, this patient is in pain. Let me give the patient some analgesic. And you go on and give prescribed analgesic. We go to the next heading, pain management. All right? Pain management. Again, this is reflecting our aim. How are you going to manage the pain? Because this patient is from theater, they'll be complaining of pain. So, number one, I'll administer strong opioid analgesic like pethidine 50 milligram intravenous to relieve patient from pain. So, this is just basically an example. Okay, this is an example. So during an exam, you can give such an example. You cannot just say, I will administer analgesic. The examiner will ask you which type of analgesic. All right, be specific, be medical. Which type of analgesic are you giving this patient? So I will administer prescribed with a strong opioid analgesic such as pethidine to relieve patient from pain. Because once the patient has gone through an operation, we give them strong opioid analgesic. Then we go to the next. I will nurse the patient using bed cradle to avoid wet linen on the incision site, hence relieving patient from pain. So it's more like you are actually applying some other means to relieve this patient from pain. Okay, more like repositioning. Remember, there are some people that will complain of pain as a result of repositioning. Maybe you didn't reposition this patient nicely. So you use other means to reposition the patient in order to relieve them from the pain. What else? I'll switch on a television and allow the patient to watch a program he or she loves to divert their mind from pain and the hospital routine. Now, the reason that each patient in their room, they have got their own television set, or if you see in acute bay, there's a television there. Okay, so you make sure that you ask the patient if the patient has regained conscious. Remember, it's just not even conscious. You can even turn on the radio because they can hear you. It's just that they cannot respond, but they can hear whatever you are saying. So you can turn on the program that they love. What you are doing is that you are diverting their mind from the pain and hospital routine. We go to the next heading. Subsequent care. So this is now when the patient is, fine, they have regained their conscious. Subsequent care. So under subsequent care, this is where we write psychological care. Okay, psychological care. Why do we give psychological care to the patient after an operation? It's because this patient they have questions. They will ask you questions, what happened during a procedure? Am I fine? Am I ready to go home? How is my wife? How is my son? How is my mother? How is my dad? They will ask you all those questions. So that's the reason why you give psychological care to the patient. So let's look at psychological care. So number one, I will tell the patient that he went for operation and the surgeons made an incision along his or her abdomen. That's why he or she is feeling the pain to allay anxiety. Now, this is one thing that you can write as well. And let me explain just on this. Some patient, they'll be complaining, nurse, why am I having this pain? This pain is so bad. This pain is so severe. Why am I having this pain? You are supposed to explain how that pain is coming in about. So, in general terms, I've said I will tell the patient, let's say, for instance, a patient went for an abdominal, operation. You say, I will tell the patient that he or she went for an operation and the surgeons made an incision along their abdomen. And that's the reason why they're having this pain. Now, when you explain that to the patient, they will have knowledge how the pain is coming in about, and you are allaying their anxiety. They won't ask you again. Some they might, but most times they won't ask you again. Then we go to another thing. I will ask the patient if there are any questions. And if any, I will answer those I can and refer difficult ones to the staff nurse or physician to allay patient's anxiety. Now, this point is very much important in an exam, even when you are working on the ward. You ask the patient, you just don't walk away. You ask the patient, oh, do you have any questions? The patient will say, no, I'm fine. And if the patient have got questions, you answer those questions that you can. Now, sometimes the patient might ask you a very complex or difficult questions. You don't have to lie. You have to be open and tell the patient that I can't answer these questions, but I'm going to refer you to my senior nurse or the doctor to come and explain further. And when you do that, the patient's anxiety will be allayed. So we are still under psychological care. The patient might also ask you, what is this oxygen cylinder doing next to me? Am I going to die? Some patients, they have phobias. Okay? Some patients have got phobias of, things around them. So I will explain the importance of the oxygen cylinder to the patient to remove fear because most patients get scared when with the oxygen cylinder. Some patients they'll simply say, is my condition getting worse because they've seen an oxygen cylinder. So you explain the reason why you have put that oxygen cylinder. Then a bullet, you simply say, I will involve a successful managed case to come and talk to the patient to change the patient's outlook of the condition and clear misconception. Now, this is very beautiful. Like, I will involve a successful managed case to come and talk to the patient to change the patient's outlook of the condition and clear misconception. Some patient, they'll be thinking like, oh, they are the only ones that have undergone through that surgical procedure. And they'll have self-doubt. They'll have so many misconceptions. I think I'm going to die. I'm the only one that has gone through this. So if the patient is open to have a discussion, you can look for someone that has, gone through the same situation that the patient, your current patient is going through, to come and have a chat and discuss with your patient. When you do that, you will clear the misconception. The patient will have confidence. So that's the reason why you do that. Then the next bullet we simply say, I will involve the patient in doing the activities like bathing, brushing teeth to make he or her feel like a healthcare team or just like a team member. Now, this is very important, involving the patient in doing, in doing activities like bathing, brushing teeth, because some people, they don't like it. You just go and bath them without involving them. It feels like an abuse. So you need to make sure that you involve the patient in whatever you want to do. You involve the patient. They'll feel like they are helping you. They'll feel like they are part of you. You make them feel so special. That's the reason why you involve the patient in doing these activities. Then the other thing is that I'll explain each procedure before doing it on the patient to gain patient's cooperation. This is absolutely important. All right? So you cannot just perform any procedure on anyone. You have to explain before you do it on the patient. The first thing is that explain the procedure. Some patient will tell you, no, I don't want this. You respect their decision. Okay? So explain the procedure to the patient. Then the reason why you're explaining the procedure, you want to gain consent. If the patient tells you, okay, that's fine, then you do it. You just don't do it. So that is what you write under psychological care. You're giving psychological care to the patient. So there can be other things that you can write that are more specific, but when you're writing post-operative care, all these points, you include them. We go to nutrition and fluid. Now, nutrition and fluid is one thing that it depends again from condition to condition. Someone can just go for a cataract surgery. You can't write like this. Okay? But we are looking at if someone has gone through a very serious surgical procedure. So, under nutrition and fluid, you simply say, on day one after operation, I will not give anything orally immediately after operation to prevent obstruction, which can occur secondary to paralytic areas. However, okay, you are not going to give anything orally. However, I will administer dextrose to prevent hypoglycemia. So it does not mean, after a patient has gone through a big procedure, you can't give anything orally because during that time, maybe the patient is still unconscious. You cannot give on day one. You transfer the patient from theater to your ward. You cannot give anything orally if the patient has gone through an abdominal procedure. Because the patient is unconscious, how are they going to swallow? But again, you cannot starve the patient. You give what? Dextrose, which is glucose. Because the tissue cells of the patient, they need glucose to function. The brain relies on glucose to function. So you don't want to starve, the vital organs such as the brain. You don't want to starve them. You don't want the brain to work on ketones, which they can't work on. So you administer dextrose to prevent hypoglycemia. So on day two, I will give fluid diet to patient to maintain blood glucose level. So on day two after an operation, you give what? A fluid diet. Just to prevent to maintain the blood glucose level of the patient. On day 3, so remember, we go on days and days. On day 3, I will serve soft food rich in proteins like fish and eggs to repair worn out tissues and help in the formation of antibodies. If you remember, in our aims, we wrote something like to prevent complications such as wound infection. Now, what is the function of antibodies? Is to fight the infection, is to fight the microbes. So each point that you write during an exam, even when someone is recovering from any illness, you just can't start feeding them solid things. No, you start gradual. Okay, so on day 3, you see, okay, this patient now is doing fine. You give what? Soft food, rich in what? Proteins. You just don't give anything because you want this patient or this person to recover. Like fish and eggs, why are you giving fish and eggs? Why are you giving fish and eggs? So this is an example of a type of food that you can give. There are so many food that you can give to replace worn-out tissues and helping them in formation of antibodies. The other bullet is that I will save soft food rich in carbohydrates like rice or porridge for glucose needed in the body for metabolic process. Now, you also have to remember you just can't give fish and eggs. You also have to give a carbohydrate. Such as what? Soft, not just a hard thing, soft food rich in carbohydrate. Like what? Rice or porridge. Because these are needed for metabolic processes. We go to the next bullet. I will say food rich in vitamins. Why are you giving food that are rich in vitamins? Give a rationale. Why are you doing that? And what type of food that you are going to serve this patient? Because even relatives, they do ask these questions. I will serve food rich in vitamins like fruits and vegetables to strengthen the patient's immunity. You're giving vitamins. Okay, you give examples of the type of vitamins that you're giving. The other bullet is that I will serve food rich in roughage to prevent constipation. Now, this is very important. Make sure that you serve the patient food rich in what? Roughage to prevent constipation. You don't want the patient who's just coming from theater to have constipation. No. Another thing, I will administer intravenous fluid to increase the blood volume and replace lost fluid during operation, thereby maintaining hydration. You tell the patient, you can continue, you can be drinking water. It's very important, drink water. You're maintaining hydration. Okay. So we go to the next bullet, which is elimination. So under elimination, once after you have eaten, what happens? So remember again, I'm going to repeat the way the cases are coming in, that's how you're supposed to write. So after someone has eaten, there's elimination. You go now to the toilet. Things needs to come out. Okay, so under elimination, you simply say, I will check and record patient's fluid input and urine output on the fluid balance chart to detect, maybe this is just an example, to detect early renal failure or any other complication that may arise as a result of that. So you make sure that you have a fluid balance chart. Okay, so it again on the fluid balance chart, it depends from country to country. So you need to make sure that you have a fluid balance chart. You check. The reason you are doing that, you want to see how much fluid input has this patient, had, and what's the fluid output. You see if they are matching, because there might be an indication of renal failure in the patient. Then we go to another bullet. I will monitor the urine for particles and proteins to detect renal failure. You do a urinalysis. If the patient has gone for theater, you make sure you do a urinalysis just to make sure what you're doing, you are making sure that this patient has no other complications. So if patient is unable to walk to the toilet, I will warm the bedpan and allow him or her to open bowels in order to prevent constipation. Now, sometimes the patient might not be able to walk, or the patient might not be ambulant. So what are you supposed to do? You cannot give the patient a cold bedpan. They will not sit on it because some bedpan are cold. Okay, so you make sure that you warm it. How do you warm it? You actually just pour lukewarm water in there, then the steam will warm, the place where they're going to sit. And then once that is warm, then they can sit on it. I'm not simply saying make it boil. No, let it be like just warm so that they are comfortable and they open bowels to prevent constipation. Because you don't want them to go for days without going to the toilet. They will have constipation. So that's what you do. We go to hygiene. After elimination, now after the patient has gone to the toilet, the patient has opened urine, we go to hygiene. So you are seeing how the case notes are coming in. So on hygiene, I will tell patient, so during this time, the patient has already regained conscious, unless otherwise. Let's read it. I will tell the patient to brush his teeth or her teeth using a soft toothbrush with Colgate and lukewarm water to prevent halitosis, tooth infection, cavities. But if patient can't do it, I will assist him or her. That's how you write it. So you tell the patient. Sometimes we just simply say, I will encourage. Some people don't like brushing their teeth. That is their choice. Okay, you encourage the patient. Do you mind, you brush your teeth? The reason why you're doing that, you don't want the patient to go home with a tooth infection or halitosis or anything, unless they want it to be that way. And if the patient is unconscious, you assist them to do that. We go to another bullet. I will tell patient to bath or to take a shower, a bath using lukewarm water and soap if he or she is able to bath to remove dead epithelial tissue and promote blood circulation. And again, if the patient cannot do these rituals, you assist the patient to take a bath. And that's the reason why we do a bed bath. But if the patient is able to walk to the bathtub, take a bath or shower, let the patient do so, of course, with your support, because the patient might fall. We go to the next bullet. I will change wet and soiled linen on the patient's bed to promote patient's comfort. This is very important because some patients, they don't have strength during that time to inform you that, oh, I want to go to the toilet. And sometimes, there will be no one and the patient is alone. Maybe you find that the linen has been soiled. You basically change everything. And the reason why you're doing that is to promote comfort. Because some patients, they will not tell you, but they are very much uncomfortable. So you make sure that you change all wet and soiled linen to promote their comfortability. So I would tell patients to clean the hair or to wash the hair to promote self-esteem and prevent, of course, pediculosis in patients' hair. Now, self-esteem is very important in the patient because if the patient has lost self-esteem, some they give up on life. So it is a duty of you as a nurse to show the examiner that you're going to boost the self-esteem. You want when the patient looks in the mirror, the patient will be happy. The hair looks kempt. The hair looks nice. It depending with man or woman. Let's go to the next bullet. we have wound cleaning. Now, if you remember, we talked about our aims, and under our aims, we had to prevent wound infection. So you can see that our nursing care is reflecting our main objectives. So let's look at wound cleaning. The patient has got a wound. Remember, they are coming from theater. So I will use prescribed solution by the physicians like spirit or Savlon when cleaning the patient's wound to prevent infection on the ward. Now remember, these solution that I've talked about, spirit or Savlon, I think they might have changed or they're still being in use. So it depends again with whichever, different countries use different solutions. So it depends with which country you are from. Make sure you check, you give at least a reference of the type of solution that you're going to use to clean the patient's wound, because you are writing an exam and you want to demonstrate to the examiner that you are up to date with the type of solution that you use to clean the wounds. Okay? The other bullet is that I will use sterile instrument when cleaning the patient's wound to prevent infection introduction on the wound. You are supposed to use sterile techniques when cleaning the wound to prevent infection. What else? I will scrub and wear sterile gloves before cleaning the patient's wound to prevent introduction of infection on the site. Before you perform wound cleaning, you are supposed to scrub your hands as a nurse to prevent infection. In some settings, they'll tell you wash your hands. In some settings, it's recommended to scrub because when you are cleaning that wound, you don't want the patient to have infection. That wound, you are using sterile instrument to clean the patient's wound. Let's go to another bullet. Prevention of nosocomial infection. Of course, the patient is still with you. The patient might have long nails. So what do you do? I'll cut long nails short from the patient's toes, and of course, I'll cut long nails. I will cut long nails short from the patient's hand and toes to prevent harboring of what? Infection. So that's what you do. Okay? Now, you, so after that, now you simply say, I will nurse the patient using reverse barrier nursing to prevent nosocomial infection. Because this patient is of high risk of catching any infection. Remember, the first line of defense from infection has already been broken. So the next bullet, you simply say, I will nurse the patient in an environment where the floor has already been mopped, of course, the one that we said at first. Then the other things that our administer prophylaxis antibiotics such as Cristopen 2.4, intravenous 4 to prevent nosocomial infection. I will tell the patient not to touch the incision site with dirty hands or apply dirty clothes to prevent a direct implantation of microbes at the incision site. Then we go to exercises. Now, this is very important. You don't want the patient just to remain on the bed. You want the patient to be performing some form of exercises. Okay. So number one is I will tell patient to support the incision site by pressing his hands on the abdomen when coughing to prevent dehiscence due to increase in abdominal pressure. So, you have seen the patient when they are coughing, they are supporting the incision site. Now, I said do not tell the patient to touch the incision site with dirty hands. When they are supporting, you have already performed a wound dressing. So they are just supporting it. When they are coughing, they don't want, when you are coughing, there's pressure that is being formed in the abdomen. So they are just supporting that incision site from opening up. The other bullet, you simply say, I will exercise the patient's limbs to prevent muscle atrophy, contractures, and deep vein thrombosis. If the patient remain in that position for a long time, what will happen? They'll have different kind of things. So you'll be exercising the limbs to prevent all these complications. Then I will tell patient to breathe in deeply and out slowly to allow full lung expansion and prevent pulmonary complications such as atelectasis. So the next bullet, we have rest. Now, these are very easy things. After exercises, someone will need to rest. Okay, after they perform exercises, they will need to rest. So I will perform all related procedures in blocks to avoid disturbing the patient, thereby promoting rest. So what you don't want to do is that you don't want to, you go check the blood pressure, you go and sit in the office, again, you go and check temperature. You don't want to do that. You want to do all the related procedures at the same time so that when you leave the patient can have enough time to rest. The next bullet is I will instruct the maintenance department to all trolleys that are making noise on the ward when wheeling them. Some trolleys, they don't make noise on the ward, okay, when you are pushing them. So you make sure that you take to the maintenance department, they apply oil so that the trolleys do not make noise when you are moving them on the ward. Otherwise, most trolleys, they disturb the patient from sleeping. Then I will answer all phone calls promptly to prevent noise, thereby allowing patient to rest. Some people, when they are answering their phone calls, they are so loud. So you need to make sure that you are answering a phone call in a very calm voice to prevent the patient from, in order to allow the patient to rest. Then I will play the radio or television set on low volume to avoid noise, thereby promoting rest in the patient. Then I'll mount a posture on the word which says silence to prevent visitors from making noise, thereby promoting rest. If you have been to hospitals, I think you have seen this. You see on the doors or on the wall they will write "silence, please." That is just informing visitors that this place which you are about to enter, please remain. Don't make too much noise because people are sleeping, others they are awake. Because some visitors they don't know about this, they'll just be talking. So you need to put a posture so that they are aware that, oh, I'm supposed to be quiet. Then we go to medication. And of course, under medication, you just simply write the type of medication that you can give. So, for example, I will administer intravenous antibiotics, which are prescribed by the physician, like Xpen, of course, for to prevent infection and promote recovery. I will administer prescribed drugs by the physician, like, of course, um, 500 milligrams for quick wound healing. I will administer analgesic, which is prescribed, like, for example, for severe pain, or paracetamol for mild pain to relieve patient from the pain. So, guys, this is how you write a post-operative nursing management. And again, I'll repeat, if you are a student and you want to pass surgery, please do make sure that you subscribe to this channel, you share this video with your friends, and you also give it a like. You can as well write these in your notes so that you load them in your mind. You memorize them, you know them by your heart, because this is how you are going to be working on the word. So thank you so much for watching, and don't forget to subscribe.